doesn't matter what you do in the day. You know, it's like if you wake up in the morning, it's a good day.
I'm Al. I'm one of the neurological liaison nurses here at MSWA. I think what sets neurological liaison nurses at MSWA apart is our specific specialised knowledge in neurological conditions. We deal with people right from their diagnosis all the way through their disease progression. So I think we're able to offer specialised care with our knowledge and the additional training we do to be able to meet their very specific and sometimes ever-changing needs. I first met Nick almost a year ago, and he is a very well-loved figure up here at Butler. Nick attends our outreach service. He's heavily involved with our nursing service as well.
My name's Nick Chapman. I've got cerebral palsy from birth and just turned 50. The first 7 years of my life was constantly in hospital, being poked and prodded and operated on so I could actually walk and get around. I then ended up working for 27 years for health and safety. It was a job that I loved. I felt really bad for leaving, but I needed to go for the health reasons. They refused my disability pension 3 times. From November 2019, I've then had help from getting services from MSWA after the approval of the disability pension. My father with pancreatic cancer. My dad goes, "Oh, your sister's going to help you when I'm not here," but then she gets MS. What my father wanted didn't happen.
For our clients, such as Nick, quite often they can face challenges in obtaining the services that they need. So in our role, we're able to provide that initial nursing assessment to get a really solid baseline of what they need and what would make a difference in their lives. Then we're in a position to advocate for them, to make the appropriate referrals, to make sure that they get the support and help that they need, be that from personal care at home through to social support so that they're able to be accessed in the community. We would really benefit from just having more of us so that we were able to expand our nursing service and be able to provide ideally 24/7 nursing care to our clients so that they have that one point of contact. That continuity of care for clients can make all the difference to them. I think one of the most rewarding things about working with Nick has been building up that therapeutic relationship with him, getting to know him as a person and not just as his condition. And he is a very inspiring guy when you learn about his journey and everything that he's been through, and that attitude that he brings to everyone around him and the joy he spreads is really inspiring. So it's been a privilege to work with him and to get to know him.
Here I am now, so I'm happy where I am because I've got the backing of MSWA. I've had trouble getting out of bed sometimes because of my cerebral palsy. I've actually been stuck where I've been at home on my own without any help. So it'd be even worse with somebody with mobility issues with a wheelchair. MSWA having a 24-hour sort of service, and that's a good thing from that point of view. The nursing staff and MSWA as a whole has been beneficial for me to get out into the community and enjoy it. So yeah, I'm just positive anyway when it comes to going out and enjoying life. It doesn't matter what you do.
Having the opportunity to work with clients like Nick, it makes my heart happy. We are in such a privileged position as nurses to be involved in our clients' care and to be a part of their journey. And it's an absolute honour to be able to do this job. And to meet people like Nick, it makes our job a lot easier.